as you all know, myself, Dr. Ruchi Jain, I'm from Nagpur, practicing predictive homeopathy since 2010. Have been associated with predictive homeopathy and conducting sadhana series lectures since last 2020. The lectures are being conducted with the hope that right homeopathy spreads to all students and they learn more and they apply it to their practice for the improvement and betterment of the students and doctors who are practicing, and they can join our hands with the noble sciences. So taking blessings from our Guru, Dr. Hahnemann sir, who has tirelessly worked day and night for homeopathy, who has faced so many hurdles in life but still could persist for homeopathy. Definitely our respected Guru, Dr. Prafull Vijayakar sir, whose recent death anniversary was there, and he left us 4 years back. But I don't think that this time I can ever miss him even 4 minutes. So he has been there with us. His blessings are there with us with his mission that yes, homeopathy has to come to the mainstream, and we are striving hard so that homeopathy comes to the mainstream. So thanking to all our gurus and definitely to all the students who are there with us as learners, all the colleagues who are supporting us. So let's begin with lot of gratitude towards them. So today's topic is something which we face every day, and they are called as the bread and butters of homeopathy because they are all the psychotic cases coming to your clinic. So what is psychosis? What is SORA? What is syphilis? If I ask a first year students, they don't know anything. If I ask a final year students, they say just we have completed exam point of view and we don't understand what miasm really is. So they still struggle. Even the practitioners, they struggle when it comes to miasms. So what miasm actually is, how to utilize the miasms into practice, and how we can see that this helps in evolving the totality to materia medica differentiation, and how miasmatic correlations can help even in the Hering's law of cure. So everything needs to be understood in that chain. So chronic diseases, if we try to understand, Hahnemann sir has faced lot of difficulty because he was seeing that lot many cases were returning to his desk repeatedly and those complaints were not getting sorted out. So he was like, there has to be some reason behind that why these diseases are not getting cured and what is the reason for them. So when he underwent his practice for 12 years and then he came up with the discovery of miasms, that is theory of organon. He has come up with SORA, psychosis and syphilis. So when you talk about SORA, it is like the irritability and sensitivity increased of that part. It is nothing but as an inflammation which takes place. What initially what happens is that whenever the body is trying to defend, when the body is trying to defend with the life forces which are going against the health, so at that time lot of inflammation sets in, and the inflammation, as you know, in the beginning is very much important for the health of an individual to maintain the homeostasis. So SORA is a basic need of survival on which we all exist. Then comes the secondary defense, that is the second defense when the inflammation is not able to overpower it and gradually the cause is continuously being there and the disease shifts its care from acute to the chronic diseases, from some physiological defense processes to the development of pathological defenses, and there sets in is psychosis. What we say psychosis is nothing but what Hahnemann sir has said is nothing but in the form of excessive degree cause dilatation, contraction, relaxation or induration, or then comes up is syphilis. But when you talk about psychosis, he has clearly mentioned when the inflammation sets in and that inflammation is chronically ongoing, which doesn't get resolved over a period of time. At that time, the second defense process comes up, that is psychosis, and psychosis is nothing but in the form of structural changes, either in the form of overgrowth, accumulation, or deposition that we will see later. But in aphorism 74, he has clearly mentioned that this defense process comes up with the structural changes. Either the organ, the tissue will dilate itself, will go into hypertrophy, will contract, will go into atrophy, or will go into relaxation or induration. That is also hyperplasia, or what we say is induration. That is a fibrous deposition or elastin tissue getting hampered. So a lot of fibrosis will come up over here. So as we see that SORA, which is a primary defense, but psychosis, which comes as a secondary defense process of the body, where there is growth, where there is dilatation, and there is relaxation or contraction. So in this today's discussion, I will be taking up more about psychosis, because the case is purely of psychosis, but how to deal with these cases, because they come to you because they have been suffering from a very long duration of their life, and they have become like an accessory symptoms of their life, and they keep on suffering. So they come to a homeopath for getting it cured. So how cure can take place in such psychotic defense processes? And then comes the third defense process, that is the syphilitic defense process, which is for the protection of the body. But when it comes to the miasm level, which is called as syphilitic miasm, there is complete destruction or a complete alteration, what we call as mutation or autoimmune diseases, which come into this sector of syphilitic diseases. So he says very clearly that these alterations and in the interior or exterior cripple the body internally or externally. So we see in psychosis and in syphilis that there are permanent tissue changes or destructive changes in syphilis and constructive changes in psychosis, which we say it's a facade. So overall, we see SORA, psychosis and syphilis, it is a defense process which goes one after the other, and again the syphilis is followed by SORA. And this is all there so that the organism is preserved, the preserver of health, and in spite of completely destroying the life, the whole destructive processes which are hostile against the health process, that is the syphilitic defense, rather than compromising the whole health, it is better to compromise a part of the tissue. So that sets in, and that whole organ or tissue starts getting destroyed because of the syphilitic miasm, which is playing its own role. So as we see, Hahnemann sir has mentioned only about 3 miasm. They can be only SORA, psychosis, and syphilis. No other miasms have been mentioned by him. So we see that when it comes to SORA, it is the basic need of an individual on which the survival instinct is there. We are surviving on the basic need that we cannot survive without food, we cannot survive without water, we cannot survive without air. So these are the basic things on which the body or the human beings are, the life force is governing us, and we are surviving upon it. So that is nothing but SORA. It is also called as mother of all generations. And then comes up, as we already said, psychosis when it comes to generation, construction, and cellular divisions which takes place, so that we get all organized thing for the betterment of us, and we try to expand ourselves. That is also psychosis. Can be healthy psychosis and a bad psychosis too. So psychosis will have its different taints. Then comes up is you protect yourself from the hostile environment, as we have already mentioned, that is syphilis, and it is the destructive defense process, destroying the tissue, giving you irreversible structural tissue damage. So syphilis will give you irreversible structural damages. Psychotic structural changes can be reverted back somehow, but they are not compromising the complete function of that organ or tissue. But in syphilis, you will find out that the function of that organ or that tissue or that cell is completely hampered or compromised. So integrity of functionality is lost when you come to syphilis. But in psychosis, somehow the body is trying to change some alterations at the tissue level so that the function can be achieved or attained. We will take this more into detail when you understand what psychosis is. So, Hahnemann sir has defined psychosis as what we saw was contraction, relaxation, induration, chronic inflammation, tissue changes. So, what our sir did was he has classified psychosis into 4 parts. He says that psychosis comes when insecurity sets in. Psychosis is a facade. You must have heard all these words. That psychosis is a defense process which hides everything behind that screen, and we don't see what the reality is, because this is an adaptation which takes place by the whole body at the tissue level so that we can attain the functional part of the body. So, psychosis, it comes to accumulation psychosis, there is synthesis, there is proliferation, and there is deposition. When you talk about accumulation, you see cases like where things get accumulated, there is lot of deposition which comes up once things are accumulated. Obesity, hyperlipidemia, diabetes, they all come under the category of accumulation psychosis. Then there is synthesis. So synthesis will be further divided into fibrin and elastin, where you will see that psychosis in synthesis, you will see disorders like prolapses, varicose. Then you will see diseases where elastin is lost. So ptosis, you will see. Then you will see into proliferation, because the need is that I am unable to perform, so I need more of helping hands, so I need to proliferate the number, I need to proliferate and increase the number of helping hands. So that is what is proliferation. Then comes as deposition. So you see diseases like renal calculus, you see the pigments getting deposited. So those all come under the deposition psychosis. So psychosis less and psychosis more, there can be 2 further divisions of psychosis excess and psychosis less. So accumulation less, accumulation excess, synthesis less, synthesis excess, proliferation will have its own part, and deposition. So further we will see through this case, this is a young person of 54 years old male who came to me with 3 complaints. When he came to me, he was sitting on the chair with crossed hands, crossed legs, with straight back, without any support, and just started talking about ki I have complaints of lumbar spondylosis. I have been told by doctors ki I have intervertebral disc prolapse. So because of which I have severe excruciating pain and I'm on bed because I cannot rest. It is very difficult for me to take rest. So these pains are really very excruciating and very severe. And since these last 20-25 days, the pains are very severe, someone is advised to take for homeopathy. But I have been suffering with this since 2005. And this patient came to me in 2024. So he says, I am unable to sit and stand. And I have a job, I have a business where I deal with sari. So I have to sit and perform sitting on the floor. So which is very difficult for me to understand, to execute my activities. So the another complaint, what he says, so first complaint is lumbar spondylosis. Another complaint is knee pain. He is also complaining of right knee injury, or he had complaint of ligament injury while he was playing badminton, and he was being operated before 4 years for this, that is around 2020, for this ligament injury. And he says since then I feel that my knees have become very weak and there is crackling sound, there is pain when I'm working or I'm standing for a prolonged time. So these are the complaints. And the third complaint, what he says, I'm really worried for my varicose veins because they are very painful. And when I am a very sporter person, I like playing lot of games and all. But right now, because of this pain, I hardly can perform any activity. So doctor, please mobilize me or help me make movements. There was very clear words while he was talking. very few words to indicate his pain. There was something, what we say, that there is clarity in what he expects from us. So he was very clear with his complaint, he was very clear with his words, and he was having a very good body language describing that this is what I am, and then he was just keeping quiet. So very few words when he came for the first visit. He came along with a 74-year-old male person, and he said he's my friend. So a 54-year coming, a person with 20 years older than him, and the other person was talking a lot, but this person was keeping quiet. So usually for the second visit, when the case came up, things were very different. But for the first visit, he was just observing the things. He was very firm to talk and very few words, and he described everything. So going ahead with what we try to understand about psychosis. So as we see the disease over here, that there is PIVD, and it is at the level of L4 and L5 vertebra. And when we see psychosis at the level of synthesis, if we see the disease, we see that there is lumbar spondylosis, there is knee osteoarthritis. That is also a degenerative change, but it is coming after injury, definitely, but it is a defense process where the knees are getting eroded, there is erosion, and then there is varicose vein. So all these things, they fall into the category of synthesis. That is definitely when you talk about elastin and fibrin. So here there is elastin which is getting affected, and here we will understand that this person is suffering with varicose veins, again because the veins are getting affected, the muscle wall of the veins are getting affected. There is prolapse intervertebral disc, because of which we can see there is elastin less. And again, you will see the third thing, that is ligament, which was being injured. So there is a ligament injury. Again, ligament is in the falling in the category of synthesis, that is elastin and fibrin. So how to go ahead with such cases, how to understand how psychosis works, we need to understand the whole process of the body. So we need to first have a glimpse what body is trying to say through this defense process, and what we mean to say that this is psychosis. So let us understand the pathology of lumbar spondylosis. For this, let us understand what body structure we have. Anatomy per se will help you to understand what tissue exactly we are dealing with. Because when you come to materia medica, you need to select a remedy which will act on the tissue, because we are dealing with similibus curantur. So we know that the disease is being brought away if a remedy or a drug proving the drug substance can produce a certain disease can definitely cure. So every drug has got a specific pathognomic character, that they affect a certain tissue or specific organ of the body. So that is called as the pathognomic action of the medicine. So that is done through drug proving, as we all know. Now we have to see is which tissues of the body of this gentleman have been affected. So we saw that it is lumbar spondylosis. So what lumbar spondylosis exactly is? So where the tissue, how is the tissue made up of? So we'll see in very short, I will just give you what lumbar spondylosis is. So we all know that we have the whole spinal cord, which is made up of vertebra, and those vertebrae are sturdy, irregular shaped bones which help the whole spinal cord to have their flexibility and movement. So we all are moving because of their spinal cord. So what spinal cord has got is bone which are attached to another, and there is some cushion material in between each bone which absorbs all these shocks which are being taken up when you are moving. There is stress, you fall down, you move, you make jerk, you lift weight, whatever. So they are the shock absorbents. So those shock absorbents are nothing but the intervertebral disc. Then they are vertebral body. And because they are so small pieces, they are being hooked up with the help of lot many ligaments are there in the whole spinal. Vertebrae are attached to each other with lot many ligaments and a lot of fibrous tissue is there in the lumbar part or overall throughout the spine. So these ligaments play a very important role of keeping these vertebrae intact in a certain posture, and they also help them to give flexibility to that extent. So if you want to bend your neck, so these ligaments will pull like an elastic fibers which are in between the articular processes. So they are nothing but the elastic fibers which help in movement and motility of the whole spine. So we know that this ligaments, that is supraspinatus or superior articular process, which is again attached with the help of intertransverse ligaments to each other. So these ligaments, they help, see there are so many ligaments. There is posterior longitudinal ligament which will help posteriorly. There is interspinous ligament, there is supraspinous ligament, there is intertransverse ligament, then there is, so they are anterior longitudinal ligament, so there is posterior also and anterior also. So you will see that our spine, which is very sturdy, is being surrounded with lot of fibrous tissue and lot of elastin to give support to this whole spine process on which we are standing erect. So this helps you to give that posture certain dignity, that value system is being added to your whole posture. If the spine, we are spineless, if we are not vertebrates, we got this vertebra, therefore we are called as vertebrates, and they came up way back in the evolution. So if you understand evolution, when we started adding value, when we started understanding now we have to stand erect and mobility started. So when mobility was very much fine, then the vertebrates came up. So those having spinal processes and the bony tissues, they are called as the vertebrates. So these vertebrae, they help you to move. So these are the ligaments. Then you have an intervertebral disc. So what is the role of these intervertebral discs? Are the shock absorber. And you know that this intervertebral disc in the center is having lot of spongy and pulpy structure, and this again because it has to give lot of lubrication. It gives lot of lubrication for that fine movements. When you drive and the lubricant is very good, you can have a smooth ride, right? So for having a good positive movement, the body needs lot of lubrication of the joints. So as you have synovial fluid in the hinge joints or in the other large joints, similarly, these intervertebral discs, because they have lot of cushion, they have this gel-like structure in between that is called as nucleus pulposus. And then surrounding them, there are a lot of fibrous tissue with net of fibers which keep this nucleus pulposus in position so that they give you lot of good oiling and good friction absorption when it comes to jerks and injuries. So what happens is whenever you strain yourself, whenever you devalue yourself, okay, whenever the spinal injury happens, then these organs and tissues are getting affected. So as you all know, when we talk about muscles, we talk about ligaments, we talk about bones, we are talking about connective tissue of the body. We are talking about those tissues who are connecting one to another. So they are all coming under the connective tissues, and the function will be definitely movement, adding value. So there are few disc problems which we usually face, and they come back to our practice. So as you know that normal disc, there is intervertebral disc which is placed into proper position with the help of anterior and posterior ligaments. But what happens is when this disc gets herniated, so this is where the disc gets bulged out. So this is only possible. You must have heard in MRI that there is intervertebral disc space reduced. So what happens that disc is reduced, the degeneration takes place, and this pulpous or spongy material which was there, that gets degenerated. So as we age, we see that our height, which was very sturdy and tall, with the age we start getting bending down, and our height also reduces. So that is because of the scoliosis, lordosis, everything which is happening is because of that degeneration which takes place at this disc level. Because the fibers are not able to keep these intervertebral disc in intact posture, the disc just bulges out because of certain jerk or injury or certain sprain or spasm which takes place, and you see that the pain is so excruciating that the patient cannot even move. And because in between the just behind through these intervertebral processes, the spinal cord is passing and lot of nerves which are passing through. So those nerves need lot of protection. So they are passing through that intervertebral canal. But because this disc just bulges out behind posteriorly, and because of which the spinal cord which is passing through, it gets compressed and there is narrowing of that space. And this intervertebral disc, because of being herniated or because of bulging, because of inflammation, it just compresses that part of the nerve and you start getting symptoms. So in our patient, as we saw, the compression is at the level of L4 and L5 vertebra. There is also a process called as disc thinning. So what happens is, because of this herniation, as we all have seen, that spongiosis, nucleus pulposus, is very spongy material which is present in between and it is like a gel. But once this gel is released, because the fibers which they get, annular fibrous which get teared off, they allow this, they were just protecting these jelly-like material in between the disc process. But just because of that injury, the disc, the annular fibrosis which was there between the spongy material, it just escaped, and because of which the disc which was being hydrated till now starts getting dehydrated. That is called as nothing but the dehydrated disc. So such terminologies you will see in the MRI. And when you see the MRI, please try and see at what level the compression is there. Is it affecting to what level? So you will see that at the transverse level, at the lateral level, they will tell you that this is L1, L4, the disc space is 12 mm, 10 mm, 5 mm, 7 mm, 6 mm. So you have excruciating pain. Till 11 mm, things are very good. There may be spasm. You will see that these spinous processes or the lumbar part, it is having a slight bend. So because of spasm, there can be straightening of spine. There can be injuries of the spine. A person could have fell down in the past, because of which there can be vertebral fractures. You will see the whole vertebra is not being visible, or there is complete collapse of that vertebra can also be seen, which indicates that there is a compression. You can see lot of degenerative changes in the in the form of osteophytes which comes up because of the friction, because the spine intervertebral disc which was helping to work against resistance which is being injured during that process. Now the two bone processes, they come together and there is a lot of friction. This friction leading to a lot of degeneration of the tissue and osteophytes they develop. So this is where you will see what we saw was the fibers which were holding the vertebrae, they become weak. And because of that loss of elasticity, the loss of that fibrin material, that the intervertebral disc comes out. So if the nerve compression is very severe, if the herniated disc is very severe, nerve compression is 5 mm, 6 mm, patient has lot of nerve symptoms or neuralgias, we say, because of which they suffer with lumbago and excruciating pains. And as we see, our patient also has been complaining of severe pain and he is unable to move for a slightest movement. So therefore, we have taken this in the psychosis. But if degeneration is complete with irreversible pathology, nerve compression is very severe and irreversible, that will go again to psychosyphilis. So how we understand this disease? So there are few terminologies which a homeopath should know, because clinically you should understand what is happening inside the body. So what is desiccation? As I have told you, the intervertebral disc has got jelly-like material in between. So that jelly-like material holds on lot of water into it and proteinaceous material. So when that is lost, So there is lot of loss of water, and that disc gets dehydrated. That is called as disc desiccation. And then there is fibrous nucleus pulposus. That is because again the disc is lost the elastic capacity, and because of which the disc they shrink into it, and there is lot of fibrous tissue getting deposited. Then loss of annular fiber integrity, again because they lose the weight bearing capacity of the ligaments and the tissues, which are very tough. They hold on the two ends very strongly, so they are the tough tissues of the body. But when they lose their integrity, the disc just bulges out from them, and the disc height reduces. That is what I said. And because of which the spinal segment which is passing through gets compressed, and then you get lot of symptoms of nerve compression. Then loss of fibers at the attachment of bone, because of which you will see that there is prolapse of vertebra also, which you can see. And lot of osteophytes they develop in between the bones, and therefore leading to lot of degenerative changes. Then there is progressive kyphosis, because the intervertebral disc is being affected. The shape which was being kept erect because of the certain shape of the vertebrae which follow, and since the ligaments which were holding them straight, they cannot maintain the integrity right now. And just because of that, losing the integrity loses the shape of the spine, and there can be either kyphosis, scoliosis, or lordosis. That is what we call. So this is in totality understanding of lumbar spondylosis at the body, at the tissue level. If you have not understood anything, you can directly ask me, because this will directly connect to you why we ask certain questions and why we take certain rubrics and why materia medica comes up. So we need a remedy which can affect the bones, which will affect the value system of the body. This is again a description about how the inflammation takes place. So this is where the herniation takes place, and the disc just bulges out from these annulus fibrosis, and there is elasticity which is lost, and because of which there is nerve compression, and these nerves which are passing, they produce the nerve pains. So we see that, so we see that why we are talking about lot of elastin fibrin when we are talking about connective tissue. We are talking about joints, we are talking about ligaments, we are talking about intervertebral disc. We have talked about the ligaments which are holding on these spinous processes. So they are the connections, right? So whenever you're talking about some or the other emotional pathology, please don't get confused. Try to understand the tissue, what it is made up of. First, what structural changes have occurred and what adaptation has taken place over here. So as we have seen, since there is disc desiccation, or the disc has lost the hydration capacity, so the disc has adapted itself and it has undergone into the process of degeneration and fibrosis. So we see here is degeneration, we see adaptation at the level of elastin and fibrin. So we see that this disease is psychosyphilis because it involves degeneration. Again, it is psychosis, elastin and fibrin less, because the holding capacity of those ligaments and the tissues have been lost, and because of which the interspinous processes which were kept into posture, just the vertebral disc, they prolapse from it. So this is all in totality about analysis. So whenever you are taking, so definitely this will come to the layer third of the 7 layers of miasms. So when we talk about any tissue, we are talking about any structure, please understand what function it has to play into your body, does to your body. As you know, it has a lot of minerals, almost 50 minerals are there, which are there in the body, in the bones, which help in maintaining the integrity and the toughness. So bone gives you a lot of toughness. Bone gives you a lot of bone. If bones have not been there, so we will be very slimy kind of individual without having that posture. So bones help you to maintain the integrity, to maintain that posture. So a person who is talking with a lot of good ego and good posture, they maintain their self like this. So people say ki you are confident, so maintain your shoulders like this. So bones definitely give you that shape and structure to the body. When you talk about ligaments, when you talk about certain joint, so alone a bone will be very rigid because it doesn't know how to bend. But when it comes to the joint surface, so with the help of the companion, with the help of two surfaces, and with the help of synovial fluid or the help of ligaments, the two joints, they start mobilizing themselves. So this is with what comes as joint. The joint is a union of two ends. So when you talk about joint, when you talk about diseases of joints, you have to talk about connections, right? You are talking about two things which are coming together. So people suffering with joint affinities, joint problems, then you have to search for what connections are getting messed up in their life. So when you're talking about bone, talk to them, ask them where you're losing the value system, because it adds value, it adds structure to your life. So you have framed your whole life in certain way, in certain order. So when that gets disrupted, someone is not giving you that value, your bones will start getting affected. So when a person tries to find its value in family, in relationship, in partnership, in work, in money, whatever, where you feel that this is my identity, this is me, what I have built up. Bone is like building a framework banaya, right? It is a framework of your body. So you structuralize your own life. तो हमने हमारी फ्रेमवर्क किधर बनाई है लाइफ में. So when you start having issues over there, you will see the conflicts coming at the bone level. So when it comes to the level of, so it adds value to you, right? So bones will come up when you start devaluing yourself. So all connective tissues of the body, they help you. You talk about ligaments, you talk about tendons are too tough. They are very hard and very tensile, and they keep the muscles attached to the bone very firmly and strongly, so that you can work against resistance forces also. So tendons will be more tougher, but not as tough as bones. So when you get injuries of the ligaments, you will find that they are also value conflicts, but not as like bones. Bones are when you get fractured bones, when you talk about fractures, when you are talking about degeneration at the level of bones, we are talking about bone diseases. You talk about any bone diseases which is degenerating the bone. You talk about fracture, two parts apart, pathological fractures of the bone. So there has to be high level of destruction at the level of value. Level of मतलब एकदम खट से बोन को अगर मुझे तोड़ना है तो मुझे उसमें बहुत सारा प्रेशर लगाना पड़ेगा और एकदम सडन प्रेशर लगाना. द वैल्यू of the person has to be deteriorated to that certain level. सिर्फ थोड़ी सी ही बात से you will not get bone fractures. For bone getting devalued, getting demineralized, if there is lot of osteoporosis, friends, if a person at a very early age is coming to you with osteopenia, which is very common in today's world, you see lot many people at very early age, they are coming with osteopenia, they are coming with osteoporosis, and you are very amazed कि यार इसका तो mineralization ही नहीं है bones में. Will have lot of obesities and demineralized bone. You can see lot of serrations. You can find out that there is so much of demineralization which has taken up. So that devaluation is very strong. Osteopenia will be a gradual devaluation which is there inside, which is coming. But for a fracture, it has to be sudden, something very harsh, very rude, which is very insulting, which has taken place, and then only a bone can break. Then you talk about tendons, because tendons also come in this category. And as I told, they are also tough, but not as tough as bones. But still they are tensile. There is lack of so much of blood supply is not there in tendons. And once tendons are injured, you all know tendon injury will take a lot of time to get repaired, and they don't get repaired. If the fibers are broken, there is complete tear or there is just a stretch Like in many cases, if I see my patient, there was an anterior cruciate ligament which was at complete tear, and that complete tear cannot be repaired by the body by itself because tendons, they don't regenerate. They are from the category of cells and tissues which do not regenerate by themselves, right? So tendon injury will also be somewhere in close to devaluation. That strong hurt, but definitely like bone, it is inside. Here it will be somewhere because tendon is playing the role of hooking up the muscle to the end of the bone. So something where I feel that I am attached. They are for the attachment. So they attach. So where I am very much attached. There, if I get valued, devalued, I will be hurt. So that is where tendons come up. So if you see a lot of tendon injuries coming up, please ask where they are hurt, they are being devalued by the person who are very close to them, on whom they find as a support system. They are attached very much to them. And then comes to a ligaments. So as we know that ligaments play a very important role. We have seen the annular ligaments which were there around the whole lumbar system. Same, every joint has got its own ligament. Without fascia, it is not there. So these ligaments, they help is hooking two joints and making those joints more mobile. Bones, they give sturdy, they give the framework, but ligaments help you in mobility. So lot of movement is there. And if lot of movement is there, is freedom. Lot of freedom, then only you can move yourself. I lock you somewhere, you won't be able to move. I lock you into a compartment, you won't be able to move. You feel that I have been tied up. So ligaments are definitely those tying knots which allow the joints to have certain amount of movements and they don't go beyond certain degree. As you all know, a shoulder joint can go to, this is called as how much angle? It is almost 180-degree angle of the shoulder joint which it can move. It can have 360-degree rotation, but that rotation of 360 degrees is not possible at the level of tendon or at the level of elbow, because elbow is a different type of a joint. It will have different ligaments which doesn't allow the elbow to rotate also to certain degree. They can pronate, supinate, but to certain degree. Similarly, your fingers. So ligaments will help you to move, plus they help you to restrict also. So when there is that controversy now, I want to move, but someone is trying to pull me, there the ligaments goes off. You will find you get ligament injuries at that time where they are working against some resistance. Like the parents might not think he can be a good player, but he wants to be a good player. He wants to be a sports person. I wanted to be a painter, right? But if my parents are not allowing me, but I am very sure that I want to go to painting compartment, whatever example I'm giving. So that was where I'm resisting myself against what my parents are wanting. So that is a support system again, but I'm missing that connection between them. So those ligaments injuries, they happen. You find those ligaments injury happening when you are mentally working against that resistance. So these conflicts come up. So definitely these are the complications when you talk about now. When you talk about the tissues, overall, we have taken bone, we took joint, we took ligaments, we talk about muscles now. So because we are talking about connective tissue, I will just give a glimpse of muscle over here, though it is not here in this case, but muscles also play a very important role. But what does a muscle give? Muscle helps you to put that framework of bones, ligaments, and tissues with good firmness. Muscles give you that strength to fight back, the strength to help you move, the strength, the willpower. When you talk about willpower, हम किसी को बोलते हैं ना, you tell me what willpower you have, and the person shows, अरे मुझ में बहुत. So that is what muscles are. So muscles are also that willpower of your body. They are the energy. They are the strength of your body. So anything which values your own strength and your ability, if I devalue you at the ability, at your ability level, मतलब हम में बहुत दम है, मैं कुछ भी कर जाऊंगा, I can work to my level. I can work this way. I can work that way. So anyone who challenges your ability will definitely hurt your muscle. So you get lot of muscle injuries which are happening when your abilities are being challenged and someone tries to devalue. So when you talk about these systems of the body, when you're talking about the connective tissue, you're talking about lot of undervaluation which is coming up. So this undervaluation is very important to unlock the cases and unlock the emotional pathology. So please, friends, don't just run behind understanding the things at a superficial level. Try to understand what disease it has affected, what tissue it has affected, and what organ or the system and what function it has compromised. And then you can unlock the emotional pathology. Aapko minute and what emotional pathology needs to be explored in that case. So every bone again will have certain function. Like if you talk about sternum, you talk about intercostal muscles, you talk about the ribs, they have the function of protection. You talk about humerus, you talk about radius and ulna, they are for the hands, they are for the movements. You talk about these interphalangeal bones, phalanges, they are for the fine movements, fine grips, motor activities of your body. So their function is different. But when you talk about vertebrae, because we are dealing with PIVD, so when you talk about that vertebral frame, so you're talking about bones, you're talking about vertebrae, they are irregular shaped. But what vertebra does is it helps you stay calm. Whenever you want to meditate, you want to do certain work, you want to concentrate, you have to sit into certain posture and just stabilize yourself. So these हम जब कभी किसी को बोलते हैं ना, you have to go for grounding. So what it means that you just have to sit and ground yourself, connect yourself to the mother earth and start working to that level that you go on grounding. That will help you to settle your ego issues, to settle your anger issues. So definitely when it comes to the vertebra, it is related to where you are connected to people, because it is again relationship. It is about so many bones which are connected to each other as a family, as a group of bones and tissues which are functioning together and performing a function in harmonious way. And most important thing is a spine, the whole spine and the whole vertebral column is allowing the most important structure of the body to pass through it. That is the spinal cord. And that spinal cord, that nerves which are passing, so many nerves which are passing from the central nervous system to the peripheral nervous system. The most important part of this vertebral column is to give protection, integrity of spinal cord. So they are all being protected. Just understand if your protection is not working. If protection is not good, what will happen? Every day you will have certain nerve injuries. You face paraplegia. You patients suffer with paraplegia, hemiplegia, quadriplegia. If injuries at the cervical level, if injuries at the lumbar level, so the whole nerves get blocked. So vertebral column is playing so many important roles. It is helping definitely to give you an erect posture, but equally to give connections, to give protection. So the problem of these spinal cords will come when you feel there is issue with protection. Again, what words are coming up? Please give importance to what words are coming up when you talk about functions of the vertebral column. So vertebral spine, it gives you some structure. So that gives you shape, that is integrity. It helps you to bear the load and responsibility on your shoulders. You bear the bag on your shoulder, but your spine allows you to hold that bag on your back. If you have to lift a good weight, you need to have a good spinal cord and a good muscle. Lot many muscles are there which is giving strength to the spinal cord. So that strength, that weight bearing capacity comes up. So different spines have got different roles. When you talk about cervical spine, it has got role of mobility and it helps you to be vigilant around. It helps you to make relationship and to see here and there. If I have to see here, I need eyes, but I need to rotate my neck. If I want to talk to you, I show and express myself with the help of these nodding actions which are helping from the cervical spine. So cervical spine is related to that emotional bondages and expression. So a lot of cervical issues will come up when you have emotional problems. So, okay, then the dorsal spine, that is your dorsal vertebrae, thoracic vertebrae which come up. So thoracic issues are when it is an issue with thoracic vertebrae, they help you to hug someone, to feel that warmth between the family. And again, I will say ki it helps you to form a bondage between the two. Again, it is helping to weight bear, definitely. But that bondages come up. Going towards the lumbar vertebra, thoracic vertebra don't move so much. But lumbar vertebrae, they have lot of movements. We are moving to and fro, right? With the help of these lumbar vertebrae only. And then they are hooked up to the sacrum and the coccyx, right? But if you talk about lumbar vertebrae, L1 to L5, again, they have different functions as we said. They are the weight bearing structures, because if I have to bend down and lift a weight, my lumbar region has to be very strong. Only then I can perform that activity. If I have to lift certain weight, it has to come on the lumbar side. So it is coming about the weight, right? So lumbar vertebra is equivalent to the weight. So whatever responsibilities, whatever financial responsibilities I am working through, I am bearing is related to the lumbar vertebrae. So whenever you see problems which are coming up at the lumbar vertebrae, there has to be certain financial issues which are coming. There has to be certain which the family is being burdening him. If you see a female, बहुत सारी iodine or some I should not take, but pain killer, muscle relax, नहीं भी आ जाएगी. All show a lady showing, my God, it's so painful. मतलब the task, the family responsibilities are coming to me. When those responsibility comes as a burden to me, I start having, oh my God, I have a backache right now. A lot of work in the family, lot of guests in the family, and I had to work again against my pressure and things. And then you will find ki kitna what to work. I have to work at home, I have to work in office, I have to go and work in the society, I have to see everything, and everything is expected from me and from my side. So all those weight is being bared is on the back of your spine, right? And then when it comes to L2, L3, L4, L5, again L2, L3, L4, L5, they also help in bearing that load. Okay? But definitely those vertebrae, I will say in totality, lumbar vertebrae, think of financial supports when they are not there and they are the alone persons. You will see, yeah, he was the alone person handling everything, so many things in the life, and suddenly he started with back pain. So if it is connected to the professional life, or that is business, or with the partner, the conflicts are there, then you will find that right side of the spinal cord will get affected. And when if it is with the family or relationship or children, then the left side will be affected. And one more thing to be added is when you talk about lumbar, you will find that they are more people who are more grounded to their roots. Matlab, they will be more attached to the family. They never run away from the family. Okay, they find it as a burden, but still they are taking that, bearing the load. They will always be ready to get hooked up in the family and the society. They are not the loner people. They don't want to be alone in the society. They are the people who are really somewhere responsible. इसलिए तो उनके ऊपर weight डाला गया. Only thing is when it comes to that resistance, when they are being pulled away, they are not being valued, they are not being appreciated, they are not being accepted in spite of taking that load, and they start suffering. Okay, so don't take it that lumbar diseases are coming up, that means the person is irresponsible. I will say yes, the person is responsible, the person has to be duty conscious, and therefore these vertebrae are coming up because the person is ready to take the weight. Only thing is if the person is not being valued, because what we saw is devaluation. So the person has got the capacity. Don't say you are very weak. Tell the person you are very strong. Only thing is the weight you are bearing is not equivalent to what capacity you have. You are bearing the weight of 100 kg, whereas you have capacity of 20 kg. So just increase your capacity and you can withstand that stress which is coming upon your head. So this is about lumbar spondylosis. When it comes to, again, when you talk about different structures, as we have seen, there are fibers, there is disc, there is nerves. So when a fiber, when you see a case of lumbar spondylosis coming to you, patient coming with lower back pain, but only thing is straightening of spine because of certain spasms which are taking at the muscle, because the muscle is being pulled. So devaluation is not that strong. Only thing is their capacity is, they are valuing that devaluation is on their own level because they are withholding the pressure against their capacity. So they have only spasms which are coming up. Because for the mind, they have that lack of confidence. So a lot of calcareas will also come over here because they don't value themselves. They don't want to increase their capacities. They are timid people. Yes, I will say they are timid people because they don't want to fight. So they are resisting themselves to go to that odd situation in that life. So this is what spondylosis comes up. And then when it comes to the level of tear, that tear what we have seen here. See, when you see only the spasms of the muscle level, they are released. Once you relax the patient because they are under stress, they are working harder than what the capacity they have. Then you have people who have got this disc bulge which is coming up. So this will be when these fibers, these annulus fibers are being teared off. Only then this disc will bulge. So something which they were hooking up, the support system which they were standing with has been lost. It can be with the parents, it can be with the bankers which they were supporting them. And suddenly that partner can be at the business level or at the home, doesn't support you and doesn't give you, allow you to stay in, because this is something jelly-like material which is being protected. So protecting you, and suddenly that protection is not there. Suddenly you are being devalued, insulted, and then you have to really, this gel has to come out of from that home. If you will see this disease, I try to perceive things like that. So that forsaken feeling, that feeling of not being loved by people, yes, being estranged definitely is there, right? So you will see in these disc problems, in these nerve compressions and the bulges, that you are somewhere like not in the family because you were in a protected environment by these annulus fibrosis, right? We have seen here this annulus fibrosis was being protected, was protecting this nucleus pulposus. Suddenly, this fibrosis was being torn away, and this, which was under a protective jelly-like environment, which was giving you certain shelter, was suddenly being thrown out of the protected environment and has to be released. That is called as disc herniation, right? So your people on which you were dependent upon, you were being felt that you were being loved by, and suddenly you lose that connection and you are being devalued by them. And then only then this is possible. Okay. So this is what, and definitely all these issues are related to the responsibilities. So you will find that these diseases, the persons who are coming with spondylosis, especially at the lumbar region, they come up with a lot of responsibility issues. They will keep on telling about your work and relationship, mein family mein kaam kar raha hu, and they really enjoy their work, but still people have ditched them. And since it is from, they don't even realize in their life, one more important thing is they don't even realize in their life that things are happening like this, because you cannot see your spinal cord, right? God has not given you the gift. You can just turn around and see your spinal cord. I don't know ki, if you have to see your back, you have to go and see a mirror which is facing, because you are not being allowed to see your back. So crisis which is happening at these level, this is one thing which I would like to add is not so obviously visible to the person that they can understand. And इसीलिए for these cases you need to dug in very deeply, because they are not consciously aware, because things have not happened in front of their eyes. If it would have happened in front of their eyes, they could have protected it and they could have stopped things happening. It just happened behind them. and it just happened blindfoldly, and therefore the person was suffering. Okay. So then again, knee osteoarthritis is the second disease which he is suffering from. And again, this has happened because of the ligament which got injured, and leading again, what leading is the synovial fluid which was helping the joint to move properly was not happening. So again, there is devaluation, not able to do the things what he wished to. It comes to, again, knee comes to performance. Weight bearing of your whole body structure comes up to knee. As we saw lumbar spondylosis, in some other case, I will definitely go into details of knee osteoarthritis also in this way, where we will understand the whole pathophysiology, how the joint tissue injury happens, and because of that chronic damage which is happening, the chronic inflammation, the bone remodeling takes place, and osteophytes, they get deposited. The whole synovial membrane is being disrupted or destroyed, and synovitis happens. So another disease, the third disease of the connective tissue which our person is suffering, is varicose veins. And we saw that varicose veins is also happening is on the right side what he's suffering. So he is again a person who is suffering with devaluation. So as we saw that bones will have lot of direct devaluation and insults, whereas muscles will have weaker. And when you talk about veins, so veins also have got a circular muscle fibers. So here also devaluation will come up. But these people are those who have got prominent varicose ulcers and to the level of DVT and all that. So they are the people who are not able to express themselves at the right person, right time or right place, and they become very excessively passive. Abhi kuch hone nahi wala hai. They are just like give up. If veins give up, the walls of the vein give up, then the person cannot perform to that level. That again is coming to the level of performance. So when you talk about connective tissue, you talk about muscles, comes to your performance. So lot of cases, wherever you will find osteoarthritis, you find lumbar spondylosis, you will find more of work. So you have to hunt for that work. You have to hunt for their system where they have found their value system, or they have defined themselves ki this is the value where I find myself. Okay. So when you talk about psychosis, as you all know, ki psychosis is nothing but because of that slow ongoing stress which has been there throughout the life, and because of which the person suffers. So Bade sir has clearly defined, if you're talking about cause, if you're talking about effect, that is the disease, the cause has to be equal and opposite. So that has to be equivalent to what result we have seen. So if you see over here a fracture, then the cause has to be sudden with that intensity. But here, since we are seeing it is a gradual process where the elastin fibrins have lost the capacity, the fibrous material has just come up, has been herniated. So the cause has to be a psychotic cause. So ongoing pressure, which has been there through years, so slow and prolonged stress. It is not something which has happened in a day or night. So there can be prolonged grief, there can be prolonged vexation, there is disappointment, lot of disappointment, and lot of brooding with that disappointment is there. Then lot of anger which has been suppressed and which is just mounting above. And since we are talking about connective tissue, so lot of mortification, that is lot of insult issues which are there, which are constantly hampering the mind. Yaar, I'm not being valued, कोई रिस्पेक्ट नहीं करता, मैंने इतना किया, मुझे क्या मिला लाइफ में, and all these things. So nursing the sick, so definitely a continuous pressure of that anxiety, non-stop anxiety which is ongoing, not only anger but lot of anxiety also which is going on. So grief which is there from loss of money, position or loved ones. So that also. So all these processes are something which are ongoing into the mind, and just it is brooding or churning, and the person cannot come out of it, the whole pitfall. Okay. So it can be about business or house cares. So this is what we have seen completely in this. Now, when we are taking these cases, how to crack the totality. That also sir has said कि when it is a slow moving psychosis, then you need to identify the miasm. So we did, and it is a psychosis. Then journey of the disease, how it has started, what were the milestones which has happened, is it because of some suppression, because of wrong medicament, how the journey started, because we have the level we have reached is the third level of the disease. So first and second level, what the person has suffered from. If you are at the level of connective tissue, so endoderm and ectoderm के level पे क्या क्या complications हुए हैं. Cause, if recent, yes, in psychosis you can take the cause, but it has to be very recent cause and it has to be relevant. Then miasm and disposition has to be identified, thermal thirst, and definitely any peculiar generals is there. And if it is psychosyphilitic, if syphilis comes into pain, and since syphilis is there, the cause loses its value. If only it is very severe, then only cause is to be considered. And if the structure has become full-blown miasm, then cause is irrelevant. And some syphilitic rubric, which is there at the mental level, has to be catched upon for prescribing the totality. And physical generals definitely need to be confirmed. So since we are in this case, so let us consider, I will just give a short glimpse of this case. So we saw throughout was the body. Till now, what I have discussed was the complete understanding of the body. Till here, we try to understand what conflicts of the person has brought the disease suffering at the generalized level. So maximum patients will come to you with this. So how to correlate into our case? We will go ahead with this case taking part. So this was a person who was being brought to me with the age of 54. He said कि ma'am, I'm a person who loves to be very active. I'm a very sports person and I don't like people who are very lazy. I don't like my daughters getting up very late. And I want that my daughters should be also there on the ground along with me, because I am also an early morning riser. And since the age of 30 years, that is almost 24 years passed away, I'm a continue cricket player, or I will play badminton, but I like to be a sports person. So he is so disciplined person. Early morning, 6 o'clock, I have to be on ground, matlab I have to be on ground. And I expect the same from my family people also and my daughter also. So we started ki, how are you and all. So he would say ki, I'm a very person who is very time conscious, very disciplined. And he was very punctual. He said ki, sir, ma'am, I'm a lone person who is handling my business. So I cannot frequently come, but I'm very prompt. I will take my medicines very regularly and I will be sincerely and honestly following it. Only thing is one of my friend who comes every Saturday will just pick up the medicines from you and deliver to me. And from that day, he's been very honest and very sincere into his time punctuality also. Then he started with his family life, and he said childhood was not that good because my father was not very responsible personality, and finances, he earned a lot of money, but all money was wasted into alcohol, and we don't know where he has utilized the money till now. And whatever I remember from my childhood, I remember that my father was very aggressive and dominating over my mother, and there were frequent conflicts in the family. And I remember that because of all those things, the environment was not so good. But that would really hurt me a lot, but I would not react because I always wanted to defend my mother and I would always stand with her. And as I was there, my younger siblings were there. So I used to just go and protect them from my father. And I was the eldest person. I have three sisters and one younger brother. So I was a person who used to take care of them whenever those conflicts were there. And I would always defend my parents. And ऐसा नहीं है कि I have so much hatred for my father. Yes, I didn't like working with him, and from a very early age, I had to start working, but I did not work with him in the shop because of the compatibility issue. So I started doing my own job of dealing with the property matters, and that I started at a very early age. I was a very good student, and I was into my second year, and I really wanted to go ahead into my work, and because I was a good student, wanted to complete my education. But since the family situations were not such that I could complete my education, so I had to leave all my education and work for my siblings so that they can complete their education. And I made sure that I took over the responsibility so well that my brother could complete the education, and now he's settled in US. And my three sisters, they got married to a very good home and they are settled now. So I would see to it that everything is done in a proper way, and this is what hard work I have done. But once my father left the shop, I started handling the sari shop equally. So now I am working. I see to it that I am working as a property dealer, where I see to it that all the papers are promptly done and I don't fall into pits where it can create certain issues. So I'm very cautious with those things also and meticulous about the paperwork. But then I also see to it that I have never shrugged upon the responsibility of my father, because of late when my father was not well, I would take complete care of him. I will take care ki he is given all the medicines. And since last 4 years, even my mother is on bed, is bedridden, and recently her hip surgery is also done. So I have taken that responsibility of my parents as well. My father passed away, and when he passed away, he realized he really, the elder son has taken the things very well, and he can die peacefully at this time. And I'm a person who was interested in joining those politics also. Even I fought for the elections because I wanted to work for the society. I'm a person who is very straightforward and don't like corruption, and I lost the election only with 8 votes. So it was such a tough tie which I have given, but family situations didn't allow me. Ma'am, what to tell you? He said he also had a lot of interest in sports, so he was a very good cricketer and lot of ambitiousness. Even today, people recognize him because he was such a good cricketer and he wanted to play very well, but family situations did not allow, and he met with an injury also, and after that, he could not play. But whenever he visits some place and there are people who were there with him, they admire him, saying ki you were such a good player, and today also we remember the way you played so enthusiastically. And you would just laugh upon her, "Hey, sir, now you are a hero. Where I stand in my life, I don't know. And I admire you now." And it's like I really miss those part of my life where I could have achieved a good position of being a good cricketer. And I know ki those family situations were not like that, but I see to it today also ki I am very regular with my sports activity, and I'm regular with badminton even today till date. So even he has pushed his daughters also for the sport activity, and he's very sincere with them. So he has very good relationship with his siblings, he says. And he says ki my sisters don't utter a single word in front of me. If I say a word, that word has to be followed. My wife, my life partner, has been very supportive with me. There are no major conflicts. She even comes to our sari shop and handles things very well. So money matters have never bothered me, because whatever life I have achieved in a good way, and my self respect is very important for me, and I achieved everything in my life, and I have fulfilled all my wishes also. Only thing, what problem went into the life when we asked you are so satisfied with your position, money doesn't matter to you, and you have gained good amount of respect. He says ki yes, there is a shop which has been opened in front of us, there is a mall which has been inaugurated, and I hardly give a heck to it, because my relationship with people are so good that people come to my shop and my business is not affected. So I'm not that jealous with people, and I enjoy that people are also growing with them. I am a person with good image in the society, and people come with lot of their conflicts to me to resolve those conflicts, because I am a person who will not do injustice with someone. So I have got a good name and good fame in my place, and I have a good position at my place. And this is what image the person has created in front of you. But the problem is ki if a person is suffering and whatever he is talking till now is all goody, 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 then why he has to suffer? Then body doesn't lie to you. Body has to indicate that something has to be there which went out of track, and therefore the person is suffering, and therefore the compromise all the functions why he is affected, that he is right now also not able to express well. So in psychosis, you have to just dig in deeper and understand ki why the person is suffering and what is happening exactly when the person is suffering. So the cause has to be correlated with the effect of the person. So the cause was exactly when we are talking about there has to be some devaluation. When you're talking about the muscular system, we know that if he's suffering with lumbar spondylosis, then responsibilities, money matters have to come in. Then when you talk about veins, you know ki not able to express the right thing in person of right person, not able to express. If it is elastin less, then where the timidity is coming up? There has to be certain timidity. Therefore, this elastin less is coming up. But this person is creating. So this is what Sir has told about psychosis. It is a facade. What they are talking about, it is complete facade where the person is trying to hide the true image in front of you, and you don't know what is exactly happening. So this is where the psychosis plays an important role, and you have to understand now what sensitivity the person is suffering with, what sensitivity he has. So while talking, he was very strong to talk, a good positive vibe was being given. But definitely there has to be certain sensitivity which was hit, and therefore the person is suffering. So we could understand ki, as I said, ki these people who are suffering with lumbar are really responsible people, and they are not irresponsible persons. They take up the responsibility very well, and they fight up with the goal also very well. Only thing is that somewhere there is devaluation. So where that devaluation was? So what devaluation has happened? So he said ki there was some transaction which was happening in US, and I had borrowed, there was some business deal which was there, and I had some glitch of short of money that was around 6 lakhs or 6, that was also not a very big amount for me, but that amount was there. So there was certain problem. So I asked my brother ki I will just transfer you the money when you come to India. Since you are in US, just transfer the money, and when you are at India, I will just give you the money back. So this is what was being told. And he said ki that money was not a big amount. My brother could have done it, but he refused, and he just delayed or procrastinated it, and he did not. He just refused on my face, and he did not transfer the money. So that has hurted me a lot. Very deeply, I got insulted, and I felt कि यार मैंने अपना education निकाला. I did not complete my desires, and I have devoted myself to my family. And when it came just to 6 lakh rupees, and this person did not trust me, and how can he not trust me? That easy, not having that trust, I will return back the money. And this hit him so well, and he said ki I was so much hurt deeply, he I even cried on that incident, and that has affected so much that I cannot forgive my brother. He comes to my home, and even if he comes, I will welcome him, I will talk to him, but I will not be normal to him what I was. So I have taken the responsibility so seriously in my life, and what went wrong, I don't know that why this incident happened. So did he not trust me to this level ki I would have returned his money back? So this has hit me so badly कि whenever I sit ideal, I sit here. So many people respect me, and my own brother on my behind is not trusting me. So that trust issue with my brother is really hitting my mind. And this self-respect devaluation is what I am bothered about. So see, what I told you is about lumbar spondylosis. I talked about ligaments, relationship. So there is a problem with relationship with brother. The issue is definitely financial. The issue is I have taken the responsibility, but my responsibilities are not being. So this is what devaluation we have to connect. So exactly the mind and body connection has come up so beautifully. You can connect. So now you can even understand key how we have to go ahead in these cases and how to interpret when it comes to emotions. So this is exactly what we have seen when we were unlocking lumbar spondylosis. So the whole conflict is not with people who are outside, but people who are amongst them own family members whom he had trusted. I have given so much to my brother in my life. So definitely I expect that he will respect me. And when he did not trust me is the biggest insult which I can feel. So this incidence has really hampered him to the level he was so much frustrated and I would say that his daughter who is supposed to go to US for his further for her further education says I will never go and visit my uncle's place. I will live in a hostel or live with people who are unknown to me but will never visit my uncle's place or will never take a what we say privilege or will not take any help from him. So this is what the level of family harmony is being disturbed because of that incidence. He comes to us. We have started talking for 3 years and 4 years. I did not talk to him also, but then we started talking. But I can never forgive him or I can never forget him because this has affected him. Ki yaar, whenever I think, whenever I sit, I get so much affected. Ki he did not trust me और वो भी सिर्फ 6 lakh rupees. It hardly matters to us and this amount is not that big for me also and he did not trust me. So this is what hits me ki I have always handled all the responsibilities so well. So where did I go wrong? I'm a person who has been very social, so conscious, so honest with people. Where did this wrong and where did I fail in executing my responsibility? So this was the complete picture and what the patient has shared and how he suffered. He has shared each step with us. He was very wholehearted to talk about the thing. He did not cry. He was well intellectually, he was sharp enough to understand what went wrong. So we have to now decipher and analyze the case at these steps. So at the will level, we know that he has got a very strong willpower. He is a very ambitious person, very conscientious person who cannot take injustice. He is a person who has taken up the responsibility, but somewhere he is attached to the family members. He has sensitivity and sympathy towards the family members and even to the society where he is attached to the parents. You saw that even to the father he was so loyal. He says ki I have to take up the responsibility of my parents even till the last end. And because I am in India, I am the person who has to go to all the relatives home. We have a very big family tree. So I am taking the responsibility of executing every responsibility related to the family also. So he's a person who we need to understand. He is a person who has got a strong sense of responsibility and that attachment to the family and taking up the responsibility drives him and pushes him on his life. But he's being affected because of that hurt which has happened because of unexpected disappointment which came up from his brother's side. So he's a person we need to understand when we analyze the case that he's industrious. Definitely we cannot ignore this or we cannot say he's a person who is very ambitious. He had so many ambitions. Therefore, he has brought all his levels, crossed all his levels in his practice of business, and he has achieved a very good position in the society. So, because these things are only possible when you are very honest with your work and you constantly want to work, involved into work and activities. So, he's a person who is very much active. So, we can take it as industrious. He's a person who has been ambitious, very sporty. Therefore, he has that sportsmanship and therefore he had joined cricket, he joined badminton. He's a person very early age, he took up responsibility of the family. It was not overburdened upon him, but he took it as a choice. He was happy executing his. He did not complain ki, my God, I had to get up so early morning. I did that. It was coming over my heart. No, he was very happy executing it. So definitely he's an ambitious and responsible. He's someone who is buried and caring personality. Yes, he is somewhere definitely he has achieved certain positions, so he is dominating. He's able to manage so many things at a time. He's managing his property business, he's managing his sari business along with all the family responsibilities. So this person has got a good management skill. So intellectually also, if you see the will, he's not a weak-willed person. Intellectually, he's a good intellect person with good business aptitude, with good position in the society. He has his own value, his own self respect. But what made him sick was the disappointment which he had, because somewhere deep down, this is part of psychosis. People say ki we work selflessly, we don't have expectations, we don't have any, we are just working. No, they have certain expectations which are hidden. That is what we say ki manushya sakta. So everything is with certain cause, everything is with certain motive and the notion. Though it can be a selfless, not as a demand, but it comes under the root. So he expected ki I have done so much in the life, so at least I expect my brother to support me. I expect my brother to be there beside me when I need help, when I am in a time of crisis. It was not crisis exactly, but still he expected the brother to support him the way he supported him. And when that support, that brother was not available, he got hurt. So this is the hurt which has come up. So he is conscientious, definitely a duty-oriented person. He says, I am very duty-oriented, duty conscious, workaholic, industrious. It is always there in his personality. He is person who will feel insulted and indignated with that incidents. He is a person who doesn't talk to. So we were trying to understand ki how Aurum Aurum behaves and why the Aurum suffers, because they have that feeling of being hurt by the family, of being rejected by the family, and they know ki I need that acceptance and I have been giving. Underline is that desire of that acceptance, and if I'm not being accepted, I feel being betrayed, I feel being received, I feel being forsaken, and that hurt I cannot take. And because of that, my anxiety is increased, my restlessness is increased, and my depression overmounts me, and I go into self-reproach that I have committed certain things wrong in my life, and therefore I have been rejected in spite of giving. And therefore, in old ages, when you see an aurum, they will be in that phase ki yes, I have done, but I wanted to do lot many things in my life. So that discontentedness of aurum is not because of not being doing anything, but because they wanted to do more, and therefore they are dissatisfied. They feel that I wanted to achieve more heights in my life, I could have done better if I would have got more days in my life, but still they have that smile of positivity in them. They will never be a people who will be not disciplined even in that end stage of their life. So this is how the aurum life evolves throughout the journey. We could understand how they have executed the responsibilities and when they go into syphilis. There is another rubric which is very syphilitic rubric, that is antagonism with herself. You will see lot of contradictory symptoms immediately when you will see the repertory study of aurum. You will see ki one symptom, another symptom. You will see ki once there is lot of anger, there is lot of contradiction, disappointment. You will see fright equally with love, love disappointment. We have seen it is one of the remedy for love disappointment, mortification, scorn from violence, mental and physical symptoms. They have anger for persons who are absent thinking of them because they cannot express the anger in the right way. Anger trifles over, anger violent. Equally, anxiety is there. antagonism with herself, only 6 remedies are there. This antagonism with herself is again a syphilitic rubric of Aurum, which we need to understand ki why this is. Because one time where the person is very ambitious, where the person is very workaholic, industrious, the other time we will find ki when they are reproaching themselves only. They find themselves as if they have done things wrong way. They have positivity with negativity inside. They want to express others. They want to get attached to people. They want to give others, but they have that fear of not expressing their true love. This is also antagonism of Aurum, which I could find because I was searching key where or antagonism should be searched in Aurum. Then you will find antagonism may they want company also, but don't want certain people in their life. They have they are full of cares and worries. Equally, you will find key they are confused also. They don't have that confidence also. So they have so many contradictory phases in life because of that syphilitic phase when it sets in. Whatever they wanted to do in life, when they go into antagonism phase, they feel that कि मैंने जो life में आज तक के achieve करना था वो तो किया ही नहीं है. So that phase and that puts them into that worthiness or self-worth loss, because of which that Aurum goes into antagonism. Ki now I don't want to because I am not capable of. So one end where there was so much of confidence into him that he could do anything. He was so industrious. And the other end, he doesn't want to because he cannot express himself. He has his own confusion with identity. क्या मैं उस काबिल हूँ, क्या मैं उसका लायक हूँ, इस तरीके से वो doing best in my academics. But when the results came up, like I was the best engineer in my academics, I was the best person who has performed in my life, I built up so many things, but this pull collapsed. So this is my failure. I will find that no, whatever my education, everything failed. The responsibility was mine. I did not go and check the cement quality. How could I do this? So this is not the right person who can work further. So better I should not work. So this is what antagonism and confusion of identity to his own. Because he goes into that delusion, because he contempt himself. He is a person who will find fault for himself. This is antagonism of Aurum. So they go to suicidal thoughts, lot of death thoughts you will see, lot of delusions you will see, doing definitely because of that misfortune feeling what they have lost everything, melancholy, misanthropy. They don't want to see their own people at the end of the life because they want. See, there is one more rubric is there is delusion that right doing nothing. So beautiful rubric that he goes into that state that he is not performing his duties in a right way to the level कि जो भी आज तक किया है वो सही नहीं किया. Therefore he goes that whatever, because he is not doing anything, because he is not in the right track, so how can he succeed? Therefore he goes into a level he cannot do everything, he does everything wrong because he cannot succeed because जो भी आज तक किया वो गलती करते आया. This is also antagonism with himself कि मैंने जो आज तक मतलब मैं जिस वर्ल्ड में जी रहा हूँ उस वर्ल्ड में मैं ही अनफिट हूँ. एंड एग्जैक्टली यू विल फाइंड कि therefore he is revolving around that own thoughts which he has web which is built up. He yes, his existence become a question and therefore he wants to die, and he wants to die with peace. He wants to die with that happiness, and therefore he wants to die because he feels this world, he doesn't belong to this world, and therefore he wants to die also. And he is a person who has that death desire with the smile on his face. I'll show you that rubric also. Yes, death desire alternating with laughing. Death thoughts give him joy. This is extreme level. You understand कि उसका thought of joy, because he feels कि I'm not belonging to this world, I'm not worthy to this world, and therefore this thought even gives him the joy. Therefore you will see an Aurum will die with gracefully. They die. They are graceful remedy because they die also gracefully. I had a demise of my guru, and when I see his each day of his death, it is 1 year passed away. almost 10 months, and I can find that each day he has died gracefully, and every moment he has lived selflessly for others. And even on his last day, he said, ki now I want that you all take up responsibility and give to the society. Each day should be given to the society. And when I'm not able to perform my duties well, this is where this is my body is getting degenerated. So now I should decide and I should leave this world before I cripple more. So this is where death thoughts give joy to him. So just see the beauty of Aurum and why Aurum goes to that level of identity crisis, existential crisis. And this is the whole mortification which disappointment takes him to this level. But that disappointment is not from others, but that disappointment is to themselves. So this is the complete picture of Aurum. I think I have made very crystal clear how Aurum, this is evolution of Aurum, I should say. How Aurum has evolved from Sora to psychosis and how he ends his world to syphilis. Again, that giving with blessings and blissfulness which he wants to ends with. So therefore, at the end also, he think that he's lost everything and he has that despair and he is discontented, displeased with himself. Lot of, see, he is doubtful to the soul's welfare of, matlab, to that salvation, anxiety of salvation में भी आप इसको consider कर सकते हो कि उसको ये भी doubt है कि मैंने जो अपनी आत्मा के लिए जो किया, देखो कहीं पर materialistic तो talk है ही नहीं. Aurum is a remedy. When you will see, it comes for those people who talk about the other worlds. They talk about Atma, Paramatma, their work. So remedy which will very beautifully affect and work for those people who are working for the society with higher purpose of existence. So that higher purpose of existence is not only what Hahnemann has said in aphorism is aphorism number 1 is not only that higher purpose is mission of that what we work for a whole some Aurum. I think those people who work for benefit of the society and for that Atma ka Kalyan, and they talk lot of Atmans, please think of Aurum and think of this rubric when you think of soulfulness. Can we take up this homework? Let's divide the rubrics of Aurum. Yes, definitely. I will be very happy if you all present TRIMIASMATIC Materia Medica of Aurum and beautifully correlate the whole journey and evolve the complete totality. And this is the thing which I wanted to present today. Any questions? We can definitely take up. Any other things to be taken up? We can definitely take up. Any confusion regarding today's presentation, things not understood or things not got by the group, we can take up. You can even present it in the group. Let others also have the benefit of the questions because someone's doubt can be cleared, others' doubts also. So this is what presentation I could do it for Aurum today. And I wish this world is full of Aurum and this world would be the most beautiful place to live in when Aurum's shed in. And therefore, friends, if you will see, the most abundant metal is there is Aurum. And because God himself wants that we should not be selfish enough, just thinking to live for ourselves, but we should also be selfless. Therefore, Aurum is spread so much around us and we work that everything shines is not gold, but yes, gold gives up a lot of purity. And wherever purity comes up, we talk about gold. So gold is equal to purity, giving to others, selflessness, and giving to the society. So if this world is full of Aurum, this will be the most beautiful place and to live in. So let's give us as a noble remedy and noble thought. Thank you, Nisha ma'am, for all your support and all the doctors who have actively participated today and motivated me to come to this discussion. And definitely lot of gratitude to our sir for him, for whom I have worked, and definitely missing all my gurus each breath of my life. And thank you. Thanks a lot of learning when they were with me. lot of learning, but lot of learning even when they have left us. So that soul journey will evolve further. Thank you. It was death anniversary of Sir. So very recently, 17th, it was there last week. So lot of things to be done. If you already want to pay a true tribute to him, please spread right homeopathy, spread right knowledge, and keep working and keep evolving. Best of luck. Thank you. We will meet very soon next month. Thank you. Let's call it end of a day. So this is the hurt which has come up. I want that integrity should be maintained and no one should cross that boundary of insulting. So better not to cross my own boundaries. He cannot support some injustice which is happening in the society and therefore people come towards him to seek help. So this is the complete understanding of the case. Any remedy which I would like you all people to please share your totality after this, because repertorial totality has to come up so that you will be able to come up with the remedial part. So please understand the disposition, how you will form the totality in this case, and how will you approach rather than just switching over to the remedial part. Please give your reasonings also. Why carcinosin? Why other remedy? Dr. Sunita ma'am, if you have written, please give your feedback also. Calcarea sulf, causticum or moxol, aurum. The remedies which are coming up in the group are carcinosin, calcarea sulf, causticum, moxol, aurum. Please give your own indications also. Aurum, natrum silicata, sadness from disappointment. Then what will be the remedies? Yes, I know ki there is a lot of disappointment. Before jumping to the remedy, I request you all please give your totality or give us your rubrics also. He's too dignified. Yes, he's too dignified. So I'm very happy that you all have come up with so many remedies, but how to understand and interpret? The picture is very clear. So further, when you talk about anything, you talk about a person, you talk form the totality, you frame it, right? You frame the personality into certain points like what sensitivity he has. The whole case is revolving around what? You have to understand that when you are unlocking the case. Is it revolving around emotions? It is revolving about some grief. Is it revolving over disappointment of love? What the person needs in his life and what has been there as a working source for him in his life. That has become his identity. From this, you will understand which category is it, a mineral, it is a metal, it is a plant, it is a animal kingdom. So do you think that throughout the disposition from this, when you frame the totality, you will understand what remedy is coming up. So first find out the sensitivity part. So what has affected as a sensitivity part? What need he has been compromised? Need versus demand when we talk about. So what has hurted him? What tissue has got affected? How he got affected? And what way he has presented his hurt and affect. So what intensity of symptoms he has in his whole presentation. So need beautiful ailments from indignation, disappointment, business, desire, industrious, responsible, and dictatorial. So you are giving a support to the remedy which you have given as carcinosin. Very good, Sunita ma'am. Thank you. Injustice can't support and ailments from ambition deceived. If you say if it is ambition deceived, ailments from mortification, yes, there is a tinge of mortification and insult in this case because he was being hurt. But the hurt is not that it is an insult. The hurt is what I have given. Thermally, he is a hot personality. No prominent physical thermals were there. He's sensitive at all parts. And he is a person who feels see, now decipher. If you feel that he's too dignified, so tell me where he has shown his dignity everywhere. Too dignified, the people has to be very haughty. They are not very generous. Too dignified, Are you talking about haughtiness? You are talking about boaster? You are talking about what? So the whole case we have seen it is revolving about work, responsibility, respect, social position. He could have taken a choice of going into gambling, earning easy money, but he took the choices of hard work and not going towards easy money. So definitely he's a person who has been a responsible person. So we take is at a positive level that this is a personality who has got, he has been industrious, competitive, ambitious. So this industriousness, competitiveness, work desire, work, all these themes when you talk about, they are under the category of not minerals, not plants, nor animals. But if it was work plus jealousy, then it would have come to the level of animals. But it is coming up work with responsibility, with position. So clearly a metal has to come up. Okay. So whenever you are defining a case, whenever you are revolving under the totality, please be crystal clear what has hurted him. So that is the value system. Throughout the case, he was talking about that I did so many responsibility. I took over the responsibilities in the family. I took over the responsibilities early in the childhood. I took the responsibility of the family so my sisters and brothers could have a good livelihood. I did not take a choice of going into wrong things. What he did not say, that also is part of psychosis. So what he did not do is he did not go into wrong fields. He did not take revenge from his father, right? In the case, you can see that he's heard from his brother. He doesn't want to talk to his brother, but it is not like that he will never talk. He said ki I have forgiven him, but not forgotten the incidents. He is ready to talk to him when he comes to India, but not from his side of keeping relationship to what it was before. Like no give and take. Okay, I know you are my brother, you come to me, you talk to me, it is okay. But I won't expect things from you now. So there is no hatred to that level of taking revenge from the personality. So that is also a positive defense if we talk emotionally also. He is a person who has lived his life with hard work and believe in hard work. He said ki I want to live working and want to go working. I cannot bear this pain because it is stopping me from my work. He is a person who has been into active sportsman. So he is working hard. So that is not the quality of any plant or mineral. It has to be a person who is very tough, right? So therefore that if you see the totality, you will get a taint of metal. See, again, I will say jumping to the remedy before understanding the case is responsible. Carcinosin will come very clear to it, very close to it. Calcarea sulf is a person who is not so much conscientious. Calcarea needs support definitely. Merc sol, if it would have been there or causticum would have been there, please understand how the sensitivities of these remedies are and how do they defend to these remedies. How the reaction is there. What is the reaction of this person is definitely he's hurt. He feels being devalued, but he has taken up all that thing inside. He doesn't have that courage or he doesn't want to throw it on that person, and therefore he has gone into psychosis less. He did not, his body did not go into psychosis excess. You cannot deny changes which have taken place. It is elastin less, and therefore the prolapse has taken place. It is not that he has gone into ulcerations or some destructive pathology like mouth ulcers, not able to express the anger, so getting lot of ulcers in the mouth, or ulcers, fissures, fistulas, some destructive pathology is not there at all in the presenting symptoms. So what is there in the presenting system is definitely the devaluation which we can see through the lumbar spondylosis. Okay? So this is a very beautifully, you have to shape the whole totality. This is evolving the structuralization of the totality. So you have to understand in your mind ki what is the sensitivity. Yes, he's sensitive. He wants that I have given so much in my life, so I want that value. At least if you cannot give me value, don't devalue. He has not begged to people give me respect. Don't disrespect me. I have, I am demanding this because I have given. It is not because I have not given to the society. So it is definitely an expectation which is coming up because I have given. I have done my goal. I have done my part in my life. And disappointment is there because I have expected from someone whom I have given so much. I have spent my life with them. So this hurt, this disappointment is not with someone who is a stranger to me, right? So from my own people. So that is what lumbar spondylosis is. Responsibility, financial, everything with their own people who are close to them, who are their support structure. क्योंकि बचपन से when I had been working, I thought these people will definitely once in my lifetime will be my support structure. But I lost them. When I expected, I was hurt. So that is disappointment, which was giving him grief, which gave him sadness, which gave him sorrow. Definitely. But not that anger which was there hidden, which was not expressed in a right way because he could not speak out. That is also against, like, I cannot fight like cats and dogs, right? So he has lost his value in front of his brother, right? He lost the value of brother also in front of him. So I took the rubrics was, again sir had said ki when you are taking a, you can take the recent rubrics, the ailments from, take the disposition, take the syphilitic part, and take the sora which has got affected. So whole totality, what got affected was mortification from indignation, which has hurt him. There was disappointment of love because there was disappointment from brother. He had loved his brother from so early. He was fatherly figure for his brother, and he did not expect things would go off track this way. There is a totality which has come up, ailments from mortification, responsibility too seriously, industrious, dignified, sympathetic, ailments from ambition, deceived, injustice cannot support. A very beautifully evolved totality, definitely. But he's surely a dignified person and a person who will stand for his right. He's sympathetic and he cannot support injustice. He ailments from ambition, deceived, I won't take because he could understand what he wanted to do in his life. Yes, his ambition was not completed and he has that feeling I want to complete my ambition, which is incomplete, but definitely a person. So the group of remedies over here, you can see that Ignatia, Natramure, even Veratrum is coming over here. Even belladonna is coming over here, but you have to understand what tissue affinity. The remedies of staph, Naxwamic, and Aurum. Three remedies are coming up. Now again, we need to filter them. We need to understand how they work, how Naxwamica would have reacted, how Staphylos aureus would have reacted, and what tissues Aurum would have affected. If it would have been Naxwamica, it would have been carcinosin, how things would have worked. Yes, carcinosin is also a person who takes up the responsibility very well through the early childhood. They are also the person who are very conscientious about trifles. They are anxious about trifles. They are very close to Aurum. Very, you look like Aurum. But if you will see, when you talk about carcinosin, you know that they are being forced to do the responsibility. Here it was not forced. He himself understood that now I have to take the command of the home and take up the responsibility so that my brothers and sisters, so there is a responsibility towards others which is more strongly there. Even carcinosin is there. Carcinosin will be more sensitive, will be more plant oriented people, nature oriented people, sympathetic people, and carcinosin are also being molded like this. But difference between carcinosin and Aurum is very strongly there on the basis of the way they lead their life. Aurum will be more stronger than carcinosin. Any other remedy? Yes, Staphylos aureus is also coming up over here. Nux vomica is coming up over here. So how will you differentiate staph and Nux vomica? So when you think about Nux vomica, you know ki the tissue affinity of Nux vomica is definitely of GIT. It will affect the musculoskeletal system, but the reaction will be of more of anger and frustration. Lot of anger issues will be there, which will be expressed through words. He might get abusive. He might use an aggressive words while describing about the brother or that incidents. More of alcoholic like Aurum. Definitely both are industrious. You will find both the remedies in industriousness, both the remedies in ambitiousness, both the remedies in ambition not achieved. They both want to achieve something in the life, and they cannot spend nights just because they want to work. So anxiety issues with anger more prominent is in Nux vomica. And after all, Nux vomica is also plant remedy with metal qualities. Nux vomica and Lycopodium, they both are the remedies which are belonging to the plant kingdom but have the quality of metals. Staphylos aureus and aurum, if you want to differentiate in this scene, you will have to understand how staph reacts and what is the need of Staphylos aureus. Staph is a remedy which is belonging to the plant kingdom. Staph is also very much dignified personality, very diligent, very timid, very honest person. But for Staph, the things come over his head. Staph is like they won't be able to express the anger anytime, and they just hold on the anger, and somewhere or the other they will just express. They both are the remedies which will stand up for dignity and anger, indignation. They both go into what you say, silent grief and all. But carcinosin will more suffer from because of these anger suppressed issues. For staph is more prominent. Aurum will be able to resolve the anger. Aurum, you will see that over a period of time, they know how to forgive that person, how to forget. Patient is hot, right? Then Staphylos aureus doesn't know how to resolve the anger. See, if you know the way they resolve the things, you should know how they react also. Staphylos aureus doesn't know to resolve. They go on chewing their anger, and one fine day they will just burst out. They feel that I cannot express my anger because they feel that they're too dignified. There is a rubric for staph. They say that too dignified to express anger is Staphylos aureus. Here it is not too dignified. Here it is more of disappointment which has come up from the brother's side, and the person cannot express that anger. Okay, so definitely indignation, industrious, we cannot define. Then there is also a rubric which I found which was very interesting. That person, aurum, is only the person who feels that they are being deserted or they are being forsaken from their closed personality. This is a very important rubric to understand in this case. Ki, yes, there was indignation, there was hurt, but there was also a issue which he felt that he was being in a delusion, that he was forsaken, he was deserted. So this feeling was also there in our patient, that I did so much to my family, but what happens, right? So ailments from disappointment, if you take this rubric, we would have always thought of Staphylos aureus and natramure, but think of even metals when it comes up with metal qualities, think of aurum, because over here there is only two metals which can be seen, alumina, which is a soft metal, but aurum and platina. They both are coming up as metals in this group, which are from the disappointments. Merc is there, but how Merc will throw the reaction, how Nux vomica will throw his reaction. Pulsatilla will come up with lot of disappointment, but timidity and weeping as a reaction. Platina will be, how dare you can do it. That disappointment is level to the ego, because Platina has got lot of dignity. Viratrum has lot of dignity into it. Viratrum also looks like very haughty, very much haughty. Sepia has got lot of small daily disappointments. I expected this, I expected that, and sepia will fall into that pit of disappointments at very small level. छोटी इशू बोलते हैं ना, वो बोलते हैं ना, अरे बर्तन नहीं, मैंने बर्तन मांजे, उसने लाके पटक के रख दिया. I happy moments I am not able to enjoy because there is no happy moment in my life. So that is what sepia will have disappointments. So when it comes to dignity, think of aurum, think of staph. When the disappointment is to the level of insult, Think of Aurum, think of staff, think of Viratram, think of when it comes up disappointment with the position, with the performance, think of Ignatia. Okay, so yes, it can be there that carcinosin. I have taken this from Kara. So carcinosin might be added. Synthesis repertory, yes, definitely. Carcinosin is also sensitive personality, so they may have expectations and they go into disappointments. So hatred for person who has offended him, when it is, see, hatred of person, here I was surprised to see that there is no lachesis or there is no ophidias which are coming up. If it comes to revenge, then ophidia might come up. But when it comes to hatred, natromure will slowly detach from that personality who has offended him. They don't show their anger outragedly. Calcarea, they will go into their own shell. Sepia, after getting offended, they go with indifference to that personality and they get just that hatred. See, don't see only hatred. See how this hatred is expressed also. Nitric acid is very murk. They both are very sour remedies. Nitric acid will break the relationship. Merc salt will see to it when they have that hatred, वो जाके destroy करेगा ही करेगा कोई ना कोई चीज. Manganum won't do it. Nux vomica will definitely show their anger in front because they also have that courage to express their anger. Staff will hold on that offense and one fine day they might burst up. So definitely, and because of that hatred, because of that forsaken feeling, there is a very beautiful rubric that sadness, friends, as if having lost affection on. This is the key to the case. What person said was कि मैंने इतना किया मेरे भाई के लिए, तो अगर मेरे भाई ने, so here what he says, what he feels is कि when I'm disappointed, Aurum is a very beautiful remedy for disappointment. We have always seen the image of Aurum as a person who is industrious, lost ambition, lost hope. No, they work for the society, they work for the people. Please understand, because they need that acceptance. They Miko, I am a very person who is very active in social work. So I will give you a very beautiful example over here. He was just talking to a person who has been doing lifetime, who has given his work for social work. And I would go and talk to him. He would always ask me, uncle would always ask me. So I would always say, अरे मैंने ना उनको खुश कर दिया, वो बच्चे खुश हुए, मैंने बच्चों के जाके शेयरिंग कर दी, तो they were very happy. मैं गौशाला गई तो I gave money. I was very happy. Those people were very happy. And so uncle asked me one question. This is what you do is to make them happy or it makes you feel happy. So I was like, definitely giving them happiness makes me happy. So he said, ki no, it is because you feel happy and therefore you're doing it. They are happy or not, you don't know, but it makes you feel happy and therefore doing it. So similarly, Aurum feels happy. Aurum wants that acceptance in society. Aurum wants that acceptance in family, and therefore they take up the responsibility so seriously because they know I have to take the responsibility, and there I will be. I want that love and affection, and therefore, when they feel that they are being disappointed, they feel that they've lost their friendship, they go into that loneliness zone, they go into that rejected zone, therefore they have delusion being forsaken, they are friendless, and therefore at the end when they feel that this was my ambition of giving happiness to the family, this was my ambition of taking the responsibility of the society and give happiness to them, and if someone disappoints them, they go into that shell and they go into suicidal thoughts, and therefore they go into destructive processes. And this is where Aurum in syphilis will go into a feeling that I could not take the responsibility being handed over to me so well. So there is a rubric of Aurum: delusion, crime committed, or delusion, criminal he is. So exactly he has not murdered someone. Aurum will not go and murder someone, but definitely because the responsibility which he has taken up in his life, which was his goal, his life ambition, he could not execute that ambition, and therefore he feels that he has not executed his responsibility, and that I am self-reproach. Aurum is a syphilis. Autoimmune diseases come up. It is not a disease of, this is not a remedy of necrosis. Aurum is a remedy of apoptosis, where it goes into self-destruction, self-death, self-killing, reproaching self. So he reproaches himself, saying that I have done the crime. I could not take up the responsibility. And that is ambition deceived. It is not ambition deceived ki I could not complete my materialistic goal. No, it is not Aurum. Aurum is immaterial. Aurum had that immaterial thought. He achieving that social position so that I could give lot of love and affection, and I can take responsibility of hundreds and thousands of people because I am that strong. I am glitter because I will glitter only when I will go to that process of whole hard work and responsibility, and where the person feels yeah I could not succeed in it. That is ambition deceived of Aurum, and not other things. It is not materialistic. It is not lycopodium where he will get disappointed because his business has failed. He will fail his failure because his responsibility could not be executed what he has set the goals. And since it is a metal, his set point would be very high. It would not be materialistic. If you remember the Maslow theory, in Maslow theory, you know it is a peak point of self-actualization is there. So metals are at that level of peak self-actualization. So that ambition is not at that ground level of bread, butter, and just having family, sexual desires, fun, family, friends. No, they won't. You will not find Aurum having enjoyment and fun in parties. You will find an Aurum serving people, and that bliss will see on your eyes when you will see Aurum serving people. They will be more happy when they are giving rather than taking. So this is what ambition deceived in Aurum is. So that deception and that disappointment will lead him to grief and mortification. That is again, he will go into churning those thoughts and going to suicidal thought tendencies because of that grief and that sorrow which disconnects him to the other world, and that causes him lot of frustration inside. So it is not that direct hit but indirect hit, and therefore when you see Aurum, if you read Aurum, you will see bone necrosis, diseases of bone of osteomalacia. Bone necrosis is there in Aurum. So why bone necrosis and not bone fractures are there in Aurum? See, again, correlate mind and body. So what body is saying? If you read Materia Medica, Aurum, Clark, you go and read Nash, you read Burnett, you will read any book, you will see specifically Aurum coming for degeneration, coming for degenerative processes, bone necrosis, bone degeneration, not for fracture. It is not a remedy which comes for fracture. So this grief, this mortification gradually, slowly goes on crippling the person inside. The dignity which he has created for himself. I have that power. God has given me that power that I can support the society. But when I'm not able to execute, I'm not able to perform my duty. That is duty consciousness of Aurum. That is duty consciousness of Aurum ki I have to serve the society, and therefore they are on that peak level. And when they are deceived, they go into that self-devaluation, and gradually the bone, which was the dignity, identity, goes into that autoimmune process of necrosis. There is no diseases like sudden fracture will not be there in Aurum. So Aurum is definitely a psychosyphilitic remedy. It is not a psoric remedy. So see how beautifully we can connect the body, how we unrevived the mind, and how we could connect it to the materia medica miasmatically also. So this is trimiasmatic materia medica which wonderfully sir has said ki every remedy will have trimism. So when Aurum is very industrious, workaholic, restless, anxious, that is the phase of Aurum when it is psychosis. So that is psychosis. Duty consciousness अगर आप देख रहे हो वो psychotic phase of Aurum है. बट अगर आप सिफिलिटिक फेज ऑफ ऑरम देखोगे तो आप देखोगे कि दे डोंट वांट टू वर्क बिकॉज दे फाइंड they don't have aversion to work. You will find the rubric over there. It is not aversion to work, but they feel that they are not worthy now to work. That is self-devaluation of Aurum, which kills himself. Understood? So this is beauty of Aurum. Ferrum is not here, though ferrum is also a metal, right? So this is the point where you have to enter Aurum. Yes, Nisha ma'am, definitely the need is acceptance. Hence he keeps on giving, doing, and takes up responsibility because that gives him happiness. So if a person sitting in front of you says ki meko jitna de, they are the people. You think of people who are selfless. Carve is the remedy who is selfless. They also believe in giving. So you will talk. So this is the theme of the case. What is the case revolving around? And the remedy has to be cracked up. What goes to the level of delusion is what is going to the level of DNA. Work. So definitely think of metals when it comes to work. Okay? So destruction of bone, degeneration, apoptosis, autoimmune. So where and how this destruction and necrosis or apoptosis or self-devaluation is there from Aurum is because of his duty consciousness and okay. Yes, so he doesn't have that. I will just show you the rubrics if I have taken, I don't remember. So definitely Aurum has mania for work. He's industrious. He feels being devalued and he feels that he has committed a crime. So it is not that crime of murder that he will go and murder, but he is here that he has not executed his task which was given to him, and therefore he could not execute the things very well. The responsibility that he could have executed was not taken well, and therefore he has that self reproach ka feeling and therefore he suffers. So this is a whole case which I have understood of Aurum, and I could present how Aurum goes and how he feels. Any questions or doubts for this much part, then I can go ahead. If not understood, anything not understood by the team, we can go ahead. So this is also a remedy. So this is a remedy which is there. Sadness, love from disappointment. So this was also a syphilitic rubric for Aurum where you have to think that how if I am disappointed from my loved people, from the people where this is self-disappointment also, where you will see not only Ignatia natrum you're coming up. Yes, it was very close to natrum. It was very close to Ignatia. But definitely how the whole picture has evolved, even Hyosamus and belladonna are there. But Hyosamus and belladonna will go into insanity if they are being disappointed. Belladonna and Hyosamus have their different needs. So why this remedy is coming into this group? Because in syphilitic phase, this is a syphilitic rubric. And when it comes to the syphilitic rubric, then understand how it will be expressed also. So Aurum, when goes into love, disappointment with sadness, will go into suicidal tendencies, suicidal thoughts, because I'm not worthy of this life now. Because my aim, my goal, my identity for which I was living is not there right now. I am being disappointed. So that will where Aurum will get affected. So this is Aurum. Anything related to Aurum, delusion, deserted, forsaken is again argentum, Aurum, camphor, calibrom, such remedies are coming up. But 2 marked Aurum is a year. So we never thought of the forsaken feeling because that goes under again love, need of being accepted. Dr. Samadhan, you had asked some question which I have missed. Can you please again ask? I have missed the link somewhere. It's above. There are so many questions popping up. Patient is hot, I said thermally. The patient is hot. That I have told. Okay. Aurum is chilly. The patient is hot. But when you are talking about psychosis, completely psychosis, syphilis, you are talking syphilis, then thermals in complete syphilitic phase, thermals are not to be taken considered. When you are talking about psychosyphilis, thermals are to be considered. Yes, the patient is thermally hot. I have expressed it before also that the patient is thermally, and the patient is right-handed. Sun he can tolerate. He doesn't like a lot of noise or a lot of DJs and all that he has expressed. He desires for fruits, dry fruits, which he likes daily, and he's not very foodie. He has his optimum diet. He is thirsty, and in winters, if very much hot, very much severe, then only he takes sweater. He takes one covering. He said ki one thing which I could have mentioned is I forgot is he is a person who says ki because of my work routine, my work was so important for me ki I suffered from UTI because I would hold my urine for long hours because I was attending customers, and I would not attend the normal urge of nature also because I would feel ki my responsibility is towards my customers and I should pay more attention to my business rather than going there. So he would just hold the urine and would not take water so that he should not go and pass urine. So that amount of workaholicness he has said. He says that my time of routine is very much fixed. I wake up at 6 a.m. means 6 a.m. it has to be 6. And I would not like getting lazy. Hatred and anger, just I would just ask people right now, let us go with the part. I will differentiate other aurums also because Aurum Natrinatricum, Aurum Sulph, Aurum Ars I have given. I have a case of Aurum Sulph. I have a case of Aurum Natrinatricum. So how to differentiate those, and Aurum Mur also. So they are the taints of aurum. They are different shades of aurum which we can take place. But since this theme, what we try to understand ki why aurum goes into syphilis and why the patient has gone into syphilis, we have to understand. So this is where the sensitivity, because every time wherever Materia Medica I have read, I was very surprised to share with you कि everywhere I was finding was industriousness, workaholic, industrious workaholic. But when we see the physical body was talking about degeneration, the physical body was talking about suicidal thoughts and killing self at certain point, autoimmunity, apoptosis, this was coming up. So there has to be certain sensitivity, and then only things will come up at this level. So therefore, I could understand that there are so many rubrics which we have just ignored because we are being overpowered with that industriousness of aurum, that shininess of aurum, that glitteriness of aurum. But we have forgot that aurum is equally strong metal which can be molded and malleable. This is the precious metal because this is the metal which can be mixed up with other metals and can be molded and malleable to make so many ornaments. So fine ornaments. Other metals are very tough to mold, but aurum is so beautifully molded up, and so fine jewelries can be made up of aurum. That kicked my mind ki yes, aurum will be equally sensitive also. So where that sensitivity is, because aurum is equally attached to the work, equally attached to the family, equally attached to relationship, but doesn't want to share that because he knows ki if I share and if I don't get back, I will be disappointed. I am a person who has that delusion in the mind that I can be neglected. I have that feeling or fear of being, if you see this rubric of delusion, deserted and forsaken, you will find that, see delusion in another sense also. जिसके अंदर डर होगा ना, उसके अंदर ही ये सब, obviously give and take. I will give more of love so that people should not reject because that is my sensitivity. So similarly, aurum has that sensitivity that they feel that it can be rejected. So therefore, that overpowers that thought overpowers them that I should not share my sensitivity with people because otherwise people will reject me or they will just forsaken me or just they will neglect me or ignore me. So that is there. So if I find syphilitic rubrics of aurum, I see a lot of sensitivities into them. So this is beauty of syphilis. This is beauty of psychosis, because psychosis, when you talk about all the pictures which are given, they're talking more of psychotic pictures of aurum. They're talking of industriousness, workaholic, glitter, ambition, all this. So that is the psychotic phase of aurum. But go and see syphilitic aurum, and that is beauty of TRIMIASMATIC Materia Medica. If you see 1, 2, 3, Sora, psychosis, syphilis. In Soric phase, as a child, he was very responsible, very positive person. Rather than going into that shell, mama, papa ladte rehte, rather than crying about it, he took up the responsibility in a conscientious way. He took up that, yes, I can study, I could complete my study, but let my brother and sister study better. I will take up the work as my duty and responsibility. So aphorism number 80, degeneration come under Sora. Everyone can go through organon and confirm. Aphorism number 80, when degeneration you talk, see this degeneration, why is it under Sora and how can you correlate it under Sora? See, what Sir says is Sora, psychosis, syphilis. Sora, psychosis and syphilis. I will open aphorism number 80 for you people. Every Sora will have certain inflammation, and every inflammation, when it comes to defense process, it goes to the level of destruction at last. So therefore, degeneration, Sora, psychosis, syphilis is a circle. Every Sora is followed by psychosis, and Sora to the extreme is when it comes to sorosyphilitic, it is degeneration. When it comes to sorosyphilitic, it is exaggeration. When you see syphilis ke 7 layers, exaggeration and mutation or cancer, they all have got its own level. So destruction can be a Sora for Merck, because since childhood, as a Merck, they are corrosive, they are destructive. So this is what I will open aphorism number 80. Incalculably greater and more important than two chronic miasm, just name, however, is the chronic miasm Sora, which wise those two reveal their specific internal dyscrasia. The one by the venereal chancre, that is syphilis, the other by cauliflower-like growth, that is what we call as psychosis. It does also after the completion of internal infection of the whole organism, announced by a peculiar cutaneous eruption, sometimes consisting only of few vesicles, accompanied by intolerable voluptuous itching, that is nothing but. So this is a rubric, this is an aphorism where even Sir has talked about ki how Sora has traveled through Sora, psychosis, syphilis, 3 miasms which are mentioned in aphorism number 80. So this is definitely, you can all see now. Yeah. So incalculably greater and more important than the two chronic miasm, just name, however, is the chronic miasm of Sora, whilst those two reveal their specific internal dyscrasia. The one with the venereal chancre is being calculated under syphilis, the other by the cauliflower, that is psychosis, does also after the completion of internal infection of the whole organism, announced by a peculiar cutaneous eruption, sometimes consisting only of a few vesicles, accompanied by intolerable voluptuous tickling, itching, and a peculiar odor, the monstrous internal chronic miasm, the Sora, the only real fundamental cause and producer of all the other numerous, I may say innumerable forms of disease, which under the names of nervous debility, hysteria, hypochondriasis, mania, melancholia, imbecility, madness, epilepsy, and convulsions of all sorts, softening of bones, that is rickets, scoliosis and kyphosis, caries, cancer, fungus, hematodes, neoplasms, gout, hemorrhoids, jaundice, cyanosis, dropsy, amenorrhea, hemorrhage from stomach, nose, lungs, bladder and womb, of asthma and ulceration of lungs, of impotence and bareness, of migraine, deafness, cataract, amaurosis, urinary calculus, paralysis, defects of the sense, and pains of the thousands of kinds, etc., figure in systemic work on pathology as peculiar independent disease. Here they have not mentioned anywhere कि they have tried to tell कि they are the fundamental cause of the disease and they are mother of chronic disease. That is what Sir tried to say. कि when the sora, if inflammation goes out of control, will lead to destruction and syphilis. So they are the diseases which will start from sora but end up into psychosis or syphilis. That is what we say: soro-psychotic, psychosyphilitic, psychopsychotic, or psychosyphilitic diseases, rather than calling them purely sora or purely syphilitic diseases. Okay, I think the question which was being asked is being clear, that they are not independent diseases. What sir has said, when they have described the layers of syphilis, when sorosoric is there, sorosyphilitic is there, soropsychotic is there, and sorosyphilitic, then syphilo-syphilitic, psychosyphilitic, and psychopsychotic. So there is classification of diseases which can be done like this. Like cancer, if it is in the terminal phases, it's syphilo-syphilitic. Autoimmune diseases, psychosyphilitic. So they are different shades of the diseases. So it is not that cyanosis, caries, or cancer are labeled under SORA. No, they have said that SORA is the fundamental cause. As we all know, that all the diseases start with primary inflammation. That is what I have taken in the initial part of the lecture, that everything starts with the primary defense process, that is inflammation. And therefore, they have said that inflammation, if not being checked, either will go into construction, or if not being checked, will go into destruction. So if it goes into construction, it is called as psychosis. If it goes into destruction, it is called as syphilis. So I hope I have made my question is very clear. The question which was being asked is being addressed. So it is not that SORA is being mentioned or degeneration is mentioned under SORA. No, they have said clearly that there are two other miasms also. We need to understand कि miasm के base में SORA है. So SORA is the base, and on that the two miasms blow up. So coming back to the presentation of our aurum. So we were trying to understand कि how aurum. So we were trying to understand कि how aurum behaves, and why the aurum suffers, because they have that feeling of being hurt by the family, of being rejected by the family, and they know कि I need that acceptance, and I have been giving. Underline is that desire of that acceptance, and if I'm not being accepted, I feel being betrayed, I feel being received, I feel being forsaken, and that hurt I cannot take. And because of that, my anxiety is increased, my restlessness is increased, and my depression overmounts me, and I go into self-reproach that I have committed certain things wrong in my life, and therefore I have been rejected in spite of giving. And therefore, in old ages, when you see an aurum, they will be in that phase ki yes, I have done, but I wanted to do lot many things in my life. So that discontentedness of aurum is not because of not being doing anything, but because they wanted to do more, and therefore they are dissatisfied. They feel that I wanted to achieve more heights in my life, I could have done better if I would have got more days in my life, but still they have that smile of positivity in them. They will never be a people who will be not disciplined even in that end stage of their life. So this is how the aurum life evolves throughout the journey. We could understand how they have executed the responsibilities and when they go into syphilis. There is another rubric which is very syphilitic rubric, that is antagonism with herself. You will see lot of contradictory symptoms immediately when you will see the repertory study of aurum. You will see ki one symptom, another symptom. You will see ki once there is lot of anger, there is lot of contradiction, disappointment. You will see fright equally with love, love disappointment. We have seen it is one of the remedy for love disappointment, mortification, scorn from violence, mental and physical symptoms. They have anger for persons who are absent thinking of them because they cannot express their anger in the right way. Anger trifles over anger violent. Equally, anxiety is there. Antagonism with herself, only 6 remedies are there. This antagonism with herself is again a syphilitic rubric of aurum, which we need to understand ki why this is. Because one time where the person is very ambitious, where the person is very workaholic, industrious. The other time we will find ki when they are reproaching themselves only. They find themselves as if they have done things wrong way. They have positivity with negativity inside. They want to express others. They want to get attached to people. They want to give others, but they have that fear of not expressing their true love. This is also antagonism of Aurum, which I could find because I was searching key where or antagonism should be searched in Aurum. Then you will find antagonism may they want company also, but they don't want certain people in their life. They have they are full of cares and worries. Equally, you will find key they are confused also. They don't have that confidence also. So they have so many contradictory phases in life because of that syphilitic phase when it sets in. Whatever they wanted to do in life, when they go into antagonism phase, they feel that कि मैंने जो लाइफ में आज तक अचीव करना था वो तो किया ही नहीं है. So that phase and that puts them into that worthiness or self-worth loss, because of which that aurum goes into antagonism. Ki now I don't want to because I'm not capable of. To one end where there was so much of confidence into him that he could do anything. He was so industrious. And the other end, he doesn't want to because he cannot express himself. He has his own confusion with identity. क्या मैं उस काबिल हूँ, क्या मैं उसका लायक हूँ, इस तरीके से वो doing best in my academics. But when the results came up, like I was the best engineer in my academics, I was the best person who has performed in my life, I built up so many things, but this pull collapsed. So this is my failure. I will find that no, whatever my education, everything failed. The responsibility was mine. I did not go and check the cement quality. How could I do this? So this is not the right person who can work further. So better I should not work. So this is what antagonism and confusion of identity to his own. Because he goes into that delusion, because he contempt himself. He is a person who will find fault for himself. This is antagonism of Aurum. So they go to suicidal thoughts, lot of death thoughts you will see, lot of delusions you will see, doing definitely because of that misfortune feeling what they have lost everything, melancholy, misanthropy. They don't want to see their own people at the end of the life because they want. See, there is one more rubric is there is delusion that right doing nothing. So beautiful rubric that he goes into that state that he is not performing his duties in a right way to the level कि जो भी आज तक किया है वो सही नहीं किया. Therefore he goes that whatever, because he is not doing anything, because he is not in the right track, so how can he succeed? Therefore he goes into a level he cannot do everything, he does everything wrong because he cannot succeed because जो भी आज तक किया वो गलती करते आया. This is also antagonism with himself कि मैंने जो आज तक मतलब मैं जिस वर्ल्ड में जी रहा हूँ उस वर्ल्ड में मैं ही अनफिट हूँ. एंड एग्जैक्टली यू विल फाइंड कि therefore he is revolving around that own thoughts which he has web which is built up. He yes, his existence become a question and therefore he wants to die, and he wants to die with peace. He wants to die with that happiness, and therefore he wants to die because he feels this world, he doesn't belong to this world, and therefore he wants to die also. And he is a person who has that death desire with the smile on his face. I'll show you that rubric also. Yes, death desire alternating with laughing. Death thoughts give him joy. This is extreme level. You understand कि उसका thought of joy, because he feels कि I'm not belonging to this world, I'm not worthy to this world, and therefore this thought even gives him the joy. Therefore you will see an aurum will die with gracefully. They die. They are graceful remedy because they die also gracefully. I had a demise of my guru, and when I see his each day of his death, it is 1 year passed away, almost 10 months, and I can find that each day he has died gracefully, and every moment he has lived selflessly for others. And even on his last day, he said, Ki now I want that you all take up responsibility and give to the society. Each day should be given to the society. And when I'm not able to perform my duties well, this is where this is my body is getting degenerated. So now I should decide and I should leave this world before I cripple more. So this is where death thoughts give joy to him. So just see the beauty of Aurum and why Aurum goes to that level of identity crisis, existential crisis, and this is the whole mortification which disappointment takes him to this level. But that disappointment is not from others, but that disappointment is to themselves. So this is the complete picture of Aurum. I think I have made very crystal clear how Aurum, this is evolution of Aurum, I should say. How Aurum has evolved from Sora to psychosis and how he ends his world to syphilis. Again, that giving with blessings and blissfulness which he wants to ends with. So therefore, at the end also, he think that he's lost everything and he has that despair and he is discontented, displeased with himself. Lot of, see, he is doubtful to the soul's welfare of, matlab, to that salvation, anxiety of salvation में भी आप इसको consider कर सकते हो कि उसको ये भी doubt है कि मैंने जो अपनी आत्मा के लिए जो किया, देखो कहीं पर materialistic तो talk है ही नहीं. Aurum is a remedy. When you will see, it comes for those people who talk about the other worlds. They talk about Atma, Paramatma, their work. So remedy which will very beautifully affect and work for those people who are working for the society with higher purpose of existence. So that higher purpose of existence is not only what Hahnemann has said in aphorism, is aphorism number 1, is not only that higher purpose is mission of that what we work for a whole some Aurum. I think those people who work for benefit of the society and for that Atma ka Kalyan, and they talk lot of Atmans, please think of Aurum and think of this rubric when you think of soulfulness. Can we take up this homework? Let's divide the rubrics of Aurum. Yes, definitely. I will be very happy if you all present TRIMIASMATIC Materia Medica of Aurum and beautifully correlate the whole journey and evolve the complete totality. And this is the thing which I wanted to present today. Any questions? We can definitely take up. Any other things to be taken up? We can definitely take up. Any confusion regarding today's presentation, things not understood or things not got by the group, we can take up. You can even present it in the group. Let others also have the benefit of the questions because someone's doubt can be cleared, others' doubts also. So this is what presentation I could do it for Aurum today. And I wish this world is full of Aurum and this world would be the most beautiful place to live in when Aurum's shed in. And therefore, friends, if you will see, the most abundant metal is there is Aurum. And because God himself wants that we should not be selfish enough, just thinking to live for ourselves, but we should also be selfless. Therefore, Aurum is spread so much around us and we work that everything shines is not gold, but yes, gold gives up a lot of purity. And wherever purity comes up, we talk about gold. So gold is equal to purity, giving to others, selflessness, and giving to the society. So if this world is full of Aurum, this will be the most beautiful place and to live in. So let's give us as a noble remedy and noble thought. Thank you, Nisha ma'am, for all your support and all the doctors who have actively participated today and motivated me to come to this discussion. And definitely lot of gratitude to our sir for him, for whom I have worked, and definitely missing all my gurus each breath of my life. And thank you. Thanks a lot of learning. Even they were with me, lot of learning, but lot of learning even when they have left us. So that soul journey will evolve further. Thank you. It was death anniversary of sir. So very recently, 17th, it was there last week. So lot of things to be done. If you already want to pay a true tribute to him, please spread right homeopathy, spread right knowledge, and keep working and keep evolving. Best of luck. Thank you. We will meet very soon next month. Thank you. Let's call it end of a day.